The explosion in popularity of GLP-1 receptor agonists, drugs like Ozempic, Wegovy, and Mounjaro, has quickly transformed the landscape of weight loss. Marketed as medical breakthroughs, these injectable drugs are often treated as miracle solutions to obesity and metabolic disease. But behind the glossy headlines and influencer testimonials is a troubling reality. Many users are now facing an unexpected, unsettling array of side effects, and society may be vastly underestimating the true physical cost of relying on these drugs for rapid weight loss. Two newly coined side effects, Ozempic mouth and Ozempic feet, have recently joined a growing lexicon of concerns, adding to a list that already includes Ozempic face, Ozempic butt, and Ozempic finger. These terms are shorthand for the physical changes that emerge when someone loses weight quickly and unnaturally. Loose, sagging skin around the mouth, wrinkled and bony feet, sunken cheeks, deflated limbs. It's not just a change in fat mass, it's a visible erosion of the body's structure and volume. For a drug sold under the promise of health and vitality, the external toll can look more like premature aging and physical decay. What we're witnessing is the physical aftermath of extreme, medically induced body mass reduction. And while the aesthetic consequences are being memified and sensationalized online, they signal a deeper issue, one that should raise urgent questions about how these medications are being used, promoted, and misunderstood. GLP-1 agonists are not magic wands. They do not sculpt the body with surgical precision. When weight loss is rapid, the body doesn't selectively burn fat in areas a person might prefer, like the waistline or thighs. It indiscriminately reduces tissue, including muscle and subcutaneous fat that give the face, hands, and feet their youthful shape and function. This indiscriminate loss of mass can make people look older, gaunt, or even sickly. The skin, long stretched to accommodate previous weight, doesn't snap back. Instead, it sags, creases, and folds, sometimes permanently. Beyond appearance, there are physical risks. Sagging skin around the mouth and jaw can affect speech and oral health. Thinner foot pads can make walking painful and increase risk of injury. The more the body is rapidly reshaped, the more vulnerable it becomes to strain, imbalance, and trauma. What's even more concerning is that these medications are now being used far beyond the original target population of patients with obesity-related metabolic disease. They've become lifestyle drugs. TikTok influencers flaunt their shrinking frames, and celebrities are whispered to be on the shot. It's being normalized among people who are not medically obese, who haven't exhausted other methods, who simply want to drop 10 or 20 pounds quickly. This casual, off-label use turns a powerful pharmaceutical into a cosmetic tool, and that's a dangerous precedent. These drugs also demand permanence. Once the medication is stopped, the lost weight frequently returns, and often rapidly. The body doesn't just resume its old shape, it can rebound with increased fat gain and less muscle. Users face the looming prospect of staying on these injections indefinitely, not only to maintain the weight loss, but also to avoid dangerous fluctuations that stress the heart, liver, and metabolism. It's not just a commitment, it's a sentence. And that sentence comes with dependencies. Weekly injections, constant attention to side effects, emotional swings from hunger suppression, mood changes, digestive issues, nausea. What may have begun as a hopeful intervention becomes a long-term medical tether. Even cosmetic fixes like fillers or surgical interventions to correct Ozempic face or sunken features are temporary and potentially risky. As the body continues to change under the influence of the drug, fillers need to be replaced. Surgical lifts may be rendered obsolete by further weight loss. Procedures that were once reserved for aging now have to be used to correct what is, in essence, pharmaceutical aging. We are not reversing time. We are accelerating it. What's lost in the stampede towards slimness is the emphasis on real health, on sustainable, slow, nutrient-dense lifestyle change. Weight loss through improved diet, strength-building exercise, and stress management may take longer, but it supports the body's structure. It preserves muscle, keeps skin elasticity intact, maintains hormonal balance, and, most importantly, teaches habits that last. The demand for GLP-1s is already spawning entire industries to manage their fallout. Trainers, nutritionists, and plastic surgeons now offer Ozempic-specific services to help people cope with the aesthetic side effects of the drug. This is a symptom of a deeper illness, the medicalization of beauty and the commercialization of desperation. No drug, no matter how effective at suppressing appetite, can override the laws of biology. There is no shortcut that doesn't extract a toll somewhere else in the body. The more society embraces pharmaceutical weight loss as a norm, the more we risk turning healthy people into long-term patients and temporary dissatisfaction into permanent dysfunction. GLP-1 receptor agonists may be medically necessary in some cases, but they are not toys. They are not style accessories. They are not consequence-free. They are powerful hormonal agents that reshape the body at a cellular level. And when used inappropriately or casually, they may leave behind not just wrinkles and sagging skin, but deep regret, nutritional depletion, and chronic instability. The real story of Ozempic is not about a miracle, it's about a warning. A society so obsessed with thinness that it's willing to gamble its health, its face, and its future for a number on a scale. And once the injection begins, the question becomes, what will it take to stop? Would you like a visual summary of this article or a spoken version to share?